Allergan is a global healthcare company based in Irvine, California. Its medical products are used in the fields of eye care, neurotherapy, obesity intervention, and urologic disorders. It's also in the field of medical aesthetics, also known as plastic surgery, and supplies a wide range of breast implants and more. Allergan is perhaps best known, though, for products in the field of medical dermatology. Botox is one of its best-known products. With the passage of the healthcare bill, Allergan, along with many other companies, is trying to figure out how it will continue to grow and adapt to new challenges in the marketplace. I met with Allergan's chairman of the board and CEO, David Pyott, to discuss his views on these issues. How are you today, David?
Great, thank you.
Thanks for joining us today.
Delighted.
So there's been a lot of talk about healthcare reform. There's been a lot of people in your industry kind of chiming the bells a little bit about this. Would you talk a little bit about how healthcare reform, the new bill, is going to impact your company and your industry?
Well, of course, this is the largest change in healthcare since the creation of the Medicare program. You know, massive bill. I think very laudable. 32 million more Americans will have access to health care. It'll be estimated about 15 million more people will have access to Medicaid. So a huge deal and very fabulous for the American people. Now, what does it mean for everybody in the industry? Well, lots of things. You know, I think the physicians are thinking about what does this mean for their payments in future, and it clearly means more like numbers that go down. For our industry, it's really clear somebody's got to pay for it. Huge taxes and fees are coming. The biggest single one is the so-called tax on pharmaceutical manufacturers. Next year for the industry, the whole US industry, $2.3 billion. After that, we have in 2013 a levy of a tax, or it is an excise tax on medical devices, 2.3% of sales. That's a big deal for the device industry. You have us having to provide a rebate for the so-called donut hole. This is roughly where a Medicare recipient falls into the out-of-pocket cost of $3,000 all the way up to $6,000, where catastrophic insurance then kicks in. And on that $3,000 to $6,000 so-called hole, we will have to pay a 50% rebate to the government. So it all adds up. Examples this week are big companies announcing what that means. Literally this week, J&J announced this will affect their top-line sales next year between $800 million and $1 billion. A few days earlier, Lilly talked about the impact being $600 to $700 million.
And how will that impact Allergan? I mean, locally and nationally, globally even.
Well, obviously, when there are huge new taxes levied, for people like me that have a global perspective, it means other markets overseas just became relatively more interesting than the US domestic market, quite clearly. As a company, differentially, we're in a better place because, in fact, the impact on the device side is less than the pharmaceutical side. And we're a balance of, we have products in both industries. And especially for us, where we're really different, is that we have all these so-called cash pay businesses, Botox, Juvederm, breast implants, Latisse, where patients elect to pay for the product completely themselves. Clearly, the federal government or state government isn't going to pay for those products as much as we could keep dreaming.
That's great. Well, how will this affect R&D and maybe jobs, or will it have an impact at all?
Clearly, for us, in terms of processing, how do we deal with this? First thing is we've got to get more efficient, and that whether it be manufacturing, whether it be the process of R&D, whether it be how we go about selling and marketing to our physicians and their patients. So clearly we have to become more efficient. For us, the real challenge will be how do we avoid cutting in to an increasing R&D budget. As a company this year, we'll spend close to $750 million in R&D. We're way up there relative to the rest of our industry, you know, in the high teens as a percentage of sales for pharmaceuticals, double digit for medical devices. And we need to protect that. And the relevance of that for Orange County is that, in fact, the largest population of employees we have here work in R&D.
That's interesting. And then, you know, part of our series is to kind of find solutions to some of the economic woes that we're facing in this country. Would you offer any kind of economic solutions or even solutions just to the healthcare bill that can make it more palatable for the industry and even better for the American people, as you mentioned earlier?
Well, I think too the government will process the healthcare bill because there's going to be thousands of pages of regulations. How do you actually implement it, which gives an opportunity for making improvements as you go along. So that's quite clear. For us and for Orange County, in fact, 50% of our employees here, of our altogether roughly 2,200 employees in Orange County, are in R&D. And to conduct R&D and to increase the budget means, the good news is we got to hire people. And it also means highly educated people. So that's our requirement of the state of California, is to invest sufficiently in K through 12 education and also continue to support whether it be Cal State system or University of California system, because that's where we hire our graduates from. In fact, we have well over 200 graduates of UCI alone here on the campus in Irvine.
Wow, that's great. Thank you very much for taking the time today. Appreciate it.
Great, thank you.
Thanks. This is Brian Calle for the Orange County Register Opinion.